This is a model of osseous connective tissue. Here we have compact bone. Here we have spongy bone. Compact bone is made up of functional units called osteons. They look like little tree trunks. In the center of the osteon, running parallel to the length, is a structure called the central canal, in which you'll find blood vessels. You'll also find nerves. The osteon is comprised of layers that are called concentric lamellae. In between the concentric lamellae are spaces called lacunae, in which osteocytes reside. Osteocytes are mature bone cells that can connect to one another through tiny little canals called canaliculi. That way they can get their oxygen and nutrients through. In between the osteons are interstitial lamellae, and on the outside of compact bone are circumferential lamellae. You'll notice that there's also a layer of dense irregular connective tissue on the outside of the bone called the periosteum, which connects to the bone by perforating or Sharpie's fibers. You'll also notice there are canals that allow blood vessels to run perpendicular to the osteon, and those canals are perforating canals or Volkmann's canals. This allows bone to have a really good blood supply. They've pulled out the osteon in layers here so you could see the different orientations of collagen fibers that give bone strength. Minerals make bone hard. Collagen fibers make bone strong. As I turn the model to show you the spongy bone is made up of trabeculae. Trabeculae describe the lace-like or lattice-like pattern of spongy bone, which allows bone to be lighter and also allows space for bone marrow. This red reticular connective tissue that you see in between the trabeculae of the spongy bone is bone marrow. Spongy bone also has lamellae and osteocytes and canaliculi.